Hey, HBC fam, it's always great to see you again. I'm so happy that you've joined us one more time. And I am Dr. T. For those who are new to our community, we welcome you. Welcome to our educational videos where we share topics on women's health with a focus on pregnancy and pregnancy-related topics, as well as fertility and the postpartum period. So we are going to talk about a very important topic today. I have realized, and it's come to my attention, that a lot of women are just not sure when they're pregnant. And so we're going to talk about what are some of the signs and symptoms of pregnancy. How do you know you're pregnant, girl? Let's talk about it. So pregnancy can oftentimes be planned, but most oftentimes is actually unplanned in a lot of cases. We love a planned pregnancy because it allows us to do certain things in a timely fashion to make sure that we secure the health of the mom and the baby. But let's be frank, ladies, oftentimes pregnancies are actually unplanned. So it's so important to know when you may be experiencing symptoms of pregnancy. So one of the most common symptoms of pregnancy is actually a missed period. That's the sign that most women look for. Here's the caveat. There are a lot of women who do not have regular periods, and so missing a period is not really that unusual. For women who have regular periods also, it's really not unusual to miss a period here and there. Let's be true, ladies. There are so many things that happen in life that can actually change the way our menstrual cycle works from month to month. For example, if you have a new medical condition, certain medical conditions can interfere with the way a woman's cycle works, such as thyroid disease, which is one of the most common medical conditions that can interfere with a woman's menstrual cycle. Other things that interfere with a woman's menstrual cycle, starting new medications. That's very common. And stress. Yes, stress can actually interfere with your menstrual cycle. So there are a number of very common things, as you can see, that can interfere with a woman's cycle from month to month. And sometimes none of those things are happening. It's just a dysfunction of the cycle in that particular month. So it's not unusual to miss a cycle here and there. Missing repeated cycles, now that's not common. And that's what we start to consider the woman to have in irregular cycles. So a cycle every now and then, not a big deal, not unusual. Repeated cycles that are missed or delayed, that is where you would want to undergo some type of evaluation to figure out why. What is the underlying cause? So for women who have regular cycles, let's say you normally have a regular cycle and all of a sudden you miss the cycle, then take a pregnancy test as soon as you realize it. Don't worry, there are many pregnancy tests that are actually able to detect a pregnancy very early, even just a few days before the missed cycle. So it's okay. If you're feeling some symptoms that are not quite yourself, feel free to go ahead and take a pregnancy test. Don't hesitate. The earlier you identify the pregnancy, the better. Beyond just a missed cycle or irregular cycle or unusual spotting, which can also happen in early pregnancy, especially at the time of implantation, what other signs and symptoms may you experience? And in this case, we're going to focus on symptoms. Signs are things that we observe as clinicians. Symptoms are things that you experience as the patient or as the woman. So what are some of the most common things? Well, let's think about it this way. If you think about for women who experience premenstrual symptoms, for women who may be on birth control, and you realize that when you're on birth control, you tend to have certain symptoms, that's in response to the hormonal changes. So the end of our menstrual cycle and starting some form of birth control can actually have very similar effect on different organs in our body as pregnancy does. So some of the things we're going to talk about today is not going to be that unusual. For example, women oftentimes have breast tenderness on birth control, breast tenderness just at the beginning of their cycle. And guess what? When you're pregnant too, you may also experience breast tenderness. Again, it's just a response of the breast tissue to the hormonal changes. Some other common symptoms include mood changes. We're not going to say moody, right? Because women bring life into this world. So we're not going to say moody, but we do have some emotional changes. Wink, wink, ladies. Yes, that's what we're going to call it. Emotional changes. We're not moody. we have emotional changes in response to our hormonal changes, right? So you may feel like, I'm not quite feeling myself. And oftentimes, some women may experience fatigue or a change in their sleep pattern, oftentimes sleeping more than they have in the past. Well, there are certain interactions between the certain centers of the brain and your hormones and metabolites of certain hormones that can actually cause that feeling of tired, fatigue, sleepiness. So that's also not unusual. And then we know that hormonal changes can affect the way the gut works. The gut is so sensitive to a lot of things, and it's really one of the stabilizing centers in our body. So the gut, not unusually, can be affected by hormonal changes. For example, some women may feel like they're a little bit more bloated than usual. Some women may also feel constipated, and that's because the progesterone that is in a high state during pregnancy actually has the ability to slow down the motility of the gut. Some women may also experience headaches. Some women before their menstrual cycle, when they're on hormones of any kind, have headaches as a side effect. And it just, again, has to do with the way the hormones interact with our body. Pregnancy is no different. There are some women who will experience headaches or new onset headaches during their early stages of pregnancy, and sometimes throughout the entire pregnancy. And then some women may also experience nasal congestion. I may be sounding a little nasal myself this evening, but nasal congestion due to some of the changes in the way secretions are produced during pregnancy. Some women may realize, is it my allergies? I suddenly feel more congested than normal. It may not actually be your allergies. Make sure you take that pregnancy test. And some women may also have some cramping in the very beginning as the uterus starts to accommodate a growing embryo in the very early stages. It's an embryo before it becomes a fetus. And that may cause a little bit of cramping in the uterus. Now, certainly if you're having increased cramping, increased intensity, especially cramping that's more than a menstrual cycle, or cramping that's more prolonged, like you're cramping the entire day and it's getting more intense, that's something that should be evaluated. And I'll explain why in a little bit. I mentioned the gut before, I'm going to go back to that. So changes in appetite. You may not want to eat certain foods. You become hypersensitive to smell during pregnancy. Certain things that used to smell good may not smell good anymore. Certain things that you like to eat, you may not have an appetite to eat it, or it may actually make you feel nauseated. So nausea and vomiting is also common during the beginning of the pregnancy. We call it morning sickness, but let's be honest, ladies, it is nowhere only in the morning. Very often, women will experience nausea and vomiting throughout the entire day, or sometimes not in the morning at all, more in the evening, midday. It varies, but you get the picture, right? So let's talk about one final organ system that we haven't talked about, right? So the urinary tract system, but specifically we're going to focus on the organ of the bladder. So because the uterus sits behind the bladder, as the uterus grows, you may actually start to experience some increase in the frequency of urination, and maybe a little bit of an increase in the urgency of going to the bathroom. Usually this will happen as the uterus starts to really ascend out of the pelvis, which happens at about 12 weeks of gestation, and really starts to compress that bladder as it grows. So frequency or changes in your bladder habits are also common signs, let me correct myself, common symptoms of early pregnancy. I mentioned spotting before. I'm going to touch on that again. So in the beginning of pregnancy, some women may actually experience spotting. That's not a period. A period is actually a flow of blood that may last anywhere from 2 to 3 days, 4 to 5 days, 7 to 8 days maximum to be normal. So having spotting in early pregnancy is also a very common symptom of pregnancy, and spotting oftentimes happens at the time of implantation. It is not a period. So when we ask for your last menstrual period, we're asking for the first day of the last normal period that you experience. And that is what we typically would like to preferably use for your dating. Now, sometimes that can be off, especially in women who have irregular cycles, and that's okay. We have ways of evaluating that. Now, let's talk about women who really should go to the doctor immediately when they think that they may be pregnant. Number one, someone who is taking a medication that may be harmful to pregnancy should contact their doctor immediately when they think that they may be pregnant. Women who had a recent procedure should also contact their doctor when they think that they may be pregnant, or their clinician. If it's a midwife, a nurse practitioner, a physician assistant, or your doctor, contact a clinician if you are in one of those two categories. Other women that we are concerned about, that we do want to contact us immediately when they think they're pregnant, are women who've had ectopic pregnancies. Those are pregnancies that are not implanted inside the cavity of the uterus, but maybe implanted in other areas of the uterus itself, or in the fallopian tubes, or outside of the reproductive system altogether. So those women who have had a previous ectopic pregnancy are certainly at risk for having a recurrent ectopic pregnancy. And those women are advised to contact their clinician as soon as possible so that we can identify the location of the pregnancy. Also, similarly, women who have intrauterine devices, so women who have IUDs, if you think you are pregnant, though an IUD is one of the most effective form of birth control and has a low failure rate of less than 1%, because it occupies the uterus, and the way the IUD prevents pregnancy is by making the uterus a hostile environment, it is possible that the pregnancy can implant outside of the uterine cavity. So women who may have an intrauterine device, also known as an IUD, definitely we recommend that you notify your clinician as soon as possible that you may think that you are pregnant. Once again, because we want to make sure we identify the location of the pregnancy to make sure it's in a safe location where it can expand and grow healthy. All right. So these are some of the symptoms of pregnancy. Don't rely solely on your menstrual cycle. Make sure you share this video with your girlfriends so that every woman is aware of some of the signs, or early symptoms, I should say. I'm correcting myself again, early symptoms of pregnancy, so that we can make sure that we initiate early prenatal care, which is so key. And you guys have probably watched a video on folic acid. So if you want to find out why early prenatal care is key, make sure you watch our folic acid supplementation video done by our midwife, Olivia. But there's just a myriad of reasons why early prenatal care is important, so that we can make sure that we have a healthy mom and baby. Start your prenatal vitamins. And the most important takeaway is plan a pregnancy. Make sure, ladies, do not hesitate to plan and empower yourself to plan your fertility. Plan your pregnancy when you would want to be pregnant. Be intentional about it. And if you do not want to be pregnant, be intentional about that also. And make sure you take measures to prevent yourself from having a pregnancy. And also knowing your options when you have a oops, I think I had a oops, so that you do not get pregnant and do not have the unplanned pregnancy you do not desire. I hope this video has been so helpful to you. I enjoy our conversations every time. And once again, make sure you share this video and check out some of our other videos, including and especially the one about folic acid, so that you will understand why starting your prenatal vitamins early, even before you get pregnant, is so crucial. We thank you guys for watching. This is Dr. T. I appreciate you for hanging out with me one more time. Love you guys. See you on the next episode. Bye.